Hi, I'm Lisa Hackett, the Ultrasound Educator. Thank you for being with me today as I'm going to go through the workings of the lovely VINNO A3 system for you. So to begin with, this is a nice compact system, and the resolution or the images that you will get from this system are very, very good and very unique. So to begin with, our main port of call is to turn it on. So the on-off button, which is situated at the top left side of the system. It takes a little bit of time, a few minutes to boot up. This is where everything starts to set itself correctly. So the most important thing you want to do, other than turning it on and off, is to actually enter your patient details. And that is done also on the keyboard, which is very, very easy to see, by an icon with a little person on it. So I'm going to press that also once it's finished booting up. So the loading bar comes up here underneath the VINNO system. Then you have a blank screen. So up here it says no patient. So you go to the patient icon, screen will come up for you. Okay, so what you do is you use your trackball and you enter your patient's details as shown. You enter their year of birth using the calendar. Then to save your details, what you will do is once again use the trackball up to where the arrow is up here, and you press your enter key. The enter key on this system is the key that sets everything for you. So now we have the patient details up here. What we do next is we move to this probe selection. So on this system you have two types of probes. You have this one with the curved type of interface, which is called a convex probe. Lower frequency gets to deeper areas. The next probe that you use specifically in musculoskeletal ultrasound and aesthetics is the linear probe. This is the one. So you go to the probe button, you select the linear probe, which is always identified with an L, and these areas here are presets by the machine to give you your overall imaging availabilities of the system. So here we have aesthetics. So once again, you use the trackball, you press enter, and then your settings automatically come up for you. So these settings are your depth, which allows you to determine where structures are within the face that you're looking at. This also gives you the overall gain, which is the black, whites and greys that you're going to see. And it also gives you predetermined colour flow settings. So when you're using the colour flow settings on this system with this probe, there's an automatic preset which allows you to see the blood vessels. Live scanning, you're going to use your thick gel, like so. You pop it on top of the probe. So it's unfrozen. If you notice there was a change in the screen, so I'm going to show you that again. When you know the screen is live, you'll have something black. When you've got something on it, you'll see changes here. The other thing which is very important for your orientation of the structures that you're looking for is determining which end of this probe is up and down or left and right. So there's two ways in which you can do this. As a sonographer, I like to touch the probe so it can tell me in what direction I'm looking at, whether it be mediolateral or superior inferior. So if I'm sitting here, it's on the left side of the screen, and that is where the large indentation on the probe is. The other end of that, we have a smaller transverse indentation. With this probe also, and all ultrasound probes, you have a central marking. So what this does is essentially show you the middle of the screen, where you can see here where my finger is, and that can tell you where you are with reference to blood vessels, fascia, bone, the parotid gland, the outer canthus of the eye. So this allows you to determine where you are midway in your imaging. Also, this allows you to evaluate and see your needle guidance. So if you choose to use ultrasound and needle guidance in your practice, for example, to remove filler or even to place filler in the correct area, you can use this central area as your marking point. So moving forward, we're going to just start. I use my probe like this. I hold the probe as if I'm holding a pen. It's very important to relax as you're holding a probe so you don't get pains through your shoulders and your necks. You use your fingers to actually stabilize that probe. So I'm going to give you an example of my forearm. So when you go across a structure, I am in the transverse plane. So as you can see here, I'm going up and I'm moving down. So you're going to be able to identify different black, whites and greys. Pay attention to the orientation of the bright white lines horizontally on this screen. So they're the fibres of the muscles. It's the outlining of the fascia, and it also outlines the nerve and associated vessels. So for me to identify some structures for you, I'm going to press the freeze button. So the freeze button here is the button that resembles a snowflake, freezing, cold. Now if I want to take that image back to make it clearer, I can use my trackball to what's called cineing back to get a clearer view. So just to show you the areas that I'm looking at here, this area is, you use the arrow button is down here. This here is the median nerve. Here. This here is your forearm muscles. This bright white line here with nothing behind it is bone. Bone is a very, very strong reflector, and the ultrasound doesn't go through bone, so it bounces back. Up here is the dermis and epidermis of the skin, which is very relevant in your area of medicine. And this area here, this grey area, is subcutaneous fat, which is also important in the face. The bright white line underneath that runs horizontally across the screen and which is bright and echogenic, is the fascial band, which is also easily accessible and identifiable on facial ultrasound. So what I'm going to do also is implement now the use of colour Doppler. So we're going to find a vessel, and I'm going to try to highlight that for you. So I'm going to decrease the gain, which means that it's going to be darker. I'm going to take my pressure off, going to freeze, and here is a blood vessel. So blood vessels are well circumscribed, rounded, ovoid, hypoechoic areas. Hypoechoic meaning black, nothing is absorbed through there. So we are going to then unfreeze. We are going to once again identify our blood vessel and press the CF button, which is above or below your annotation control. And there we have our blood vessel. So this is in the transverse plane. It's an artery because it's pulsating. So to evaluate anything on ultrasound, you actually need to observe the structure or area of interest in both the transverse and the longitudinal plane. It's a beautiful blood vessel there. So we can freeze that once again, and I can highlight that for you. So this is your blood vessel identified. It's in the longitudinal plane, which means it's running along the vessel. Also, this yellow area or box area is termed the region of interest. Now, this is an area that you can manually change according to the area that you want to observe. So when it comes to the face, the vessels are very, very small. As I alluded to before, the pressure of this probe needs to be very light because they are easily compressible. So we can adjust this region of interest box, which is also on your control pad, which is this button just here that says ROI, and you can manipulate that and change it to get better resolution. So we will unfreeze, and I'll actually show you how we can do that. I'll go transverse for you. It's a lot easier for me to manage. And then I'm going to press the region of interest box, and I'm going to use the trackball to change that. And then we're going to highlight the area again. Once again, when you're doing your vessels of your face, looking for product placement, potential product placement, or potential compressing occlusions, you have very, very light pressure on these vessels. Now, the other thing you want to be wary of is the blue and the red does not determine whether it's arterial or venous flow. What this type of colour flow does show you is directional flow. So when the blood vessels are going towards your probe or your transducer, it is red. When it's running away, it is blue. So bear in mind with that one. The other thing is, which we'll get into detail more when I come and see you personally, is you compress veins, you can't compress arteries. Another thing to note too, where you have a neurovascular bundle or you have vessels, you quite often have associated nerves. Now in the face, they're very, very small. So just be very mindful of where you're going to place your product to see where things are. You are aware, or you should be aware, that there is potentially little nerve endings around there as well. So that's a basic introduction into the use of the A3 system. Like I said before, it's a very, very nice system to use. It's compact. The resolution or the images that you get from this system are pretty much state of the art for its size. It's easily portable. It's easily used. Yeah, and there's basically only 3 buttons you really need to concentrate on. We can get down a little bit further, where, as I said to you before, individually go through your settings of using the TGC or the gain individually. You've got your overall gain, the adjustment of the depth, zooming in areas. But the main things you need to know is turning it on and off. You want to know how to freeze and unfreeze. You want to know how to put the patient details in. And then at the end of your examination, you want to close it. So to close your image, you go back to 2D or B mode. That will take everything off there that you've had. It's one button. It's a lot easier to do. Workflow is very easy. And then you just push the button with the paper and the tick on it, and that will turn it off for you. And it will save it for you. There we go, all done. And there we go, nice little introduction. Hopefully that helped you.